My name is Beth Shubin Stein, and I'm an orthopedic surgeon who specializes in sports medicine and shoulder surgery. When I approach a patient, my main goal is getting them back to their sport or lifestyle of choice in as high a functioning way as possible. But there are different goals for different types of patients. If I have a young patient who comes in with an ACL injury, my goal is to return them to their sport, but it's also to protect their knee. And so it's a lot of education, both for the patient and oftentimes the parents, in terms of what it means to return to sport and why it takes so long, and oftentimes why they can't return to sport without having that surgery. For patients who are older and for patients in whom the problem is more pain-related than instability-related, it's really about listening to the patient in terms of what they want to achieve and trying to get them back to as full of functional recovery, essentially getting them back to being able to do what they want to do with less pain. When I see a patient who has an ACL injury, I don't just think about the ACL injury. I also think about the fact that after the surgery, they're going to need a lot more than just my care. They're going to need the care of a very good physical therapist. For young patients, often the psychology of an ACL tear and how to approach the next 6 months while they're doing their rehab is more than they want to deal with or can deal with on their own. And we have sports psychologists who can help with that. We have lots of great nutritionists who help us with the post-injury and post-surgery nutrition involved in getting patients back to their prior level of performance. And all of those things are key components which are readily available here. The process begins long before I see them. It begins when they realize they can't do what they used to do. It begins from the moment they have an injury and are worried about what's going to happen to them and how they're going to achieve what level of function they want given this injury. And to watch them move through that process of injury, surgery, recovery, and finally full return to function is a wonderful and incredibly gratifying part of what I do.